Cirrhosis is end-stage liver disease. It's irreversible. It initially is an inflammatory state that then moves on to become fibrosis. The biliary channels become obstructed. This leads to portal hypertension. So think about this for a minute. You know that a huge portion of the venous blood return that is coming from the GI tract passes through the portal circulation. So much of the blood that's coming from the gastrointestinal tract that's carrying the nutrients that have been absorbed through digestion passes through the liver. And if the liver becomes fibrotic, the blood has great difficulty getting through the liver because of the fibrosis. It increases pressures in the liver. That causes portal hypertension. There are a variety of underlying causes of cirrhosis: viral hepatitis, alcohol abuse, many others, but certainly viral hepatitis and alcohol abuse are the two most common. Cirrhosis is the most common cause of portal hypertension, which is a problem that has great clinical significance. So when the scar tissue blocks the flow of blood through the liver, you get these high pressures in the portal venous system, and that's caused by resistance to portal blood flow that's within the liver and occurs just after the liver. But that high pressure then gets transmitted back, and it can affect other organ systems as well. Among the other organs that are affected by portal hypertension are the spleen and the vascular supply. When blood is having difficulty getting through the liver because of portal hypertension, one of the consequences is congestion of the spleen. So the spleen is large and spongy. Think of it as your body's giant sponge. It can become a big reserve of blood, which can be good and bad. If that blood is not able to pass through the liver because of portal hypertension, the spleen becomes congested. The blood will also seek alternative pathways of less pressure to get back to the right heart. And what that leads to is the development of what is called varices. So these are venous plexus that form around organs and become engorged as the blood looks for a different way to get back to the right heart. So these typically form in the lower esophagus, around the stomach, in the abdominal wall, and in the perirectal area. Those varices are susceptible to rupturing, leading to bleeding. One of the most dangerous forms is when you have rupture of the esophageal varices, leads to significant hematemesis, and can be life-threatening. So this picture is showing you the development of those varices that I mentioned. Here are a couple, but you can see the rectal varices that form as an alternative route for the blood to get back to the right atrium. You can also see others that are clinically significant in the esophagus. They form at the base of the esophagus. There are ones that can form around the stomach as well. But again, this is blood that's seeking a route other than the liver because of portal hypertension. Can't get through the liver. It's got to find another way back to the right heart. What's the result of cirrhosis? You get varices, splenomegaly, and ascites. So the varices is the blood trying to find alternative pathways back to the right atrium. What's shown here is the portal hypertension of the liver. Normally you'd see these black arrows. They represent the normal blood flow into the liver that's coming from the GI tract. Because it's under so much pressure from the portal hypertension, you can see is represented by these yellow arrows is the formation of the ascites. So there's significantly increased intravascular pressure, which pushes that fluid out of the vascular space. So that's the hydrostatic pressure that's now no longer in balance, and the pressure is increased, forcing the fluids outside of the vascular space. This arrow here also shows you how you develop splenomegaly as blood gets congested in the spleen because it can't move through the liver. Ascites is the accumulation of transudative fluid in the peritoneal cavity. The most common cause of ascites is cirrhosis. However, it can also be associated with other clinical syndromes, anything that leads to portal hypertension. It can occur because of the decreased synthesis of albumin by the liver, or the loss of albumin in nephrotic syndrome, for example. But it leads to renal sodium and water retentions as the body tries to hang on to fluid, because all of this free fluid is leaving the vascular space. So it creates a vicious cycle where the total body water increases. So this fluid leaves the vascular space. It leads to reduced perfusion of the kidneys. The kidneys sense a type of dehydration, even though the body's not dehydrated. That fluid is just in the wrong place. And so the kidneys retain sodium, and water follows sodium. It's a significant disease, as indicated here, 25% mortality in the first year, especially when it's associated with cirrhosis. And it leads to abdominal distension with all this free excess fluid that has left the vascular space. Here's a representation of liver failure. You can see gynecomastia that results from a change in estrogen metabolism as a result of liver failure, because that estrogen is not being metabolized in males. It can lead to gynecomastia and testicular atrophy. You can see the caput medusa and the creation of the umbilical hernia there from the ascites. The caput medusae are one of the forms in which the blood is seeking an alternative route because of the portal hypertension. And then you can see the accumulation of the ascites in the abdomen. That's the third spacing of fluid in the abdomen, and edema in the lower extremities. So take a moment to review the various clinical findings of cirrhosis as represented here. One of the other consequences of liver failure is called hepatic encephalopathy. Although the exact cause is not known, what's believed is that there's a buildup of toxic material in the body because the liver is not functioning, it's failing, it's unable to break down toxins that accumulate in the body. So we suspect ammonium as having a role because one of the treatments is to give patients medications that reduce their ammonia level, and many patients who are early in the stages of hepatic encephalopathy improve when their ammonia level comes down. But it leads to significantly impaired behavioral, cognitive, and motor functions, and is often one of the end stages of liver disease. So what do you think is the leading cause of acute liver failure in the United States? It's acetaminophen toxicity. And one of the main reasons is because there are so many different over-the-counter preparations of medications for a variety of reasons that contain acetaminophen. And then patients take acetaminophen on top of it. So you can see all of these different cold remedies and other things that are used often contain acetaminophen. So whether it's sinus congestion relief, or relief from a common cold, or relief from a headache, patients don't recognize that these medications that are available over the counter often contain acetaminophen, and then they take acetaminophen on top of that. So always encourage your patients to read the labels carefully and make sure that they're not taking too high a dose of acetaminophen. So here's just a reminder to drive that home. Make sure that you check the medication's labels and do not exceed 4 grams of acetaminophen per day. And again, like with other things, when you sort of add insult to an underlying or existing liver disease, it's even worse. So patients with underlying liver disease should be told no Tylenol, no acetaminophen at all. Use alternative medications like ibuprofen. And those patients who are on acetamin should be warned. Make sure that you read labels of drugs that you're taking over the counter that are combined medications and don't exceed the recommended dose of acetaminophen. There are other causes of acute liver failure. Viral infections that we've already reviewed, hepatitis A, B, C, and D, A, B, and C being the most significant. There are other poisons that can cause acute liver failure and other drugs that can cause acute liver failure. And then there are some underlying diseases such as Wilson's disease and others that can cause acute liver failure.